was a very elaborate, yes, yet concise presentation, and with your personal touch, it made it more fun. Thank you so much, sir. I welcome Dr. SANITHA for her presentation, that is troubleshooting after spectacle prescription. Over to you, madam.
A very good morning to all of you. I'm happy that you have turned up for the first session. And so, how many of you have had a patient who had actually he was a pain in your neck after prescribing spectacles? Can I have a show of hands? Okay, there are a few who are lucky ones, but thank you, Dr. Arun, for setting the background for my talk. Now we'll be talking about troubleshooting after spectacle prescription. So just like we say, once we do a cataract surgery, once we do enough number of cases, all of us will have some complications, will have some difficult patients. Like that for if you give a lot of spectacles, however perfect your team may be, however perfect your prescription may be, you will have some patients who are unhappy. So when this patient comes to your office, the first reaction would be, oh my God, he's out of the door and now I'm having a difficult time. And but this person, he has told that your most unhappy customers are your greatest source of learning. So if you are doing a spectacle business, or even as a practitioner also, unhappy patients teach us a lot. So I'll try to share some of the learnings which I have had in running a hospital and being a person who has prescribed a lot of spectacles. So patient will have a lot of complaints. So we'll try to group it as systemic, visual and mechanical. What are the systemic complaints? Headache, we know കണ്ണട വെച്ചിട്ട് ഭയങ്കര തലവേദനയാണ്. Where is the തലവേദന? It can be anywhere, periorbital, frontal, even occipital, temporal, in the whole head. Don't think that the patient is lying. It can produce such a difficult symptom also. And they might have dizziness, nausea, fatigue, and even a burning sensation. And what are the visual complaints? Mostly they will say that they have a blurred vision for distance, near or intermediate, and distortion of images and tilting of images, or ghosting, or a kind of double vision is also very common. Some patients, especially with anisometropia, they might complain of image size disparities, distance judgment errors. Sometimes patient may complain that I have been tripping frequently, I'm not able to walk down the stairs, so this depth perception may be impaired. And mechanical things are a little lighter. There could be tightness behind the ears or nose, and usually while reading it slides down the nose and the lens appears too thick, and rainbow effect at the periphery, some scratches, and the expectations were different. All these are patients' possible complaints. So first of all, in the investigation, whose wrong is it? So we have different parties in this task. Is it from the refractionist? Is it from your optician? Is it the patient itself? Or is it because of some issues inherent to the lenses? So these possibilities of error are with all of these people. Optometrists can have incorrect refraction, or incorrect prescription, or incorrect transcription of the details. And there could be a failure to identify and adjust for the facial anomalies. Sometimes, as sir told, there could be a failure to include the vertex distance, and incorrect advice regarding the choice of lenses. From the optician part, again, incorrect transcription does happen sometimes, and wrong positioning of the optical centers, that axis marking, if it is wrong, this is going to trouble the patient. And wrong conversions, error in placement of segments, and failure to advise patients regarding suitable frames. So in some patients also, like sir told, if you have a new presbyope and he needs a progressive glasses, but he wants a very small frame, you are going to have problem with this patient. So you have to advise the patient regarding the choice of frames. Some patients may have really very unrealistic expectations, like the glasses are going to solve all their problems. Usually these patients suffer a lot, and different patients have different tolerance thresholds. So that is also one issue. And there is something called buyer's remorse. Once you go and get a spectacle, you buy a 25,000, 30,000 spectacle because the salesman was very efficient. And once you go home the next day, when you see the spectacle, you feel, oh, that kind of thing will be there. Most of us also have that. So this will create some buyer's remorse, and then they might say that it is because of the problem with the spectacles. And very rarely you have patients who are feigning difficulties for refund. And what are the issues inherent to lenses? So base curve or lens thickness changes sometimes pose a problem, anisometropia, and when you use progressive addition lenses, there could be a distortion of peripheral vision and small reading area. That is a problem which is inherent to the lens, but it will cause a problem for the patient also. So most important thing in troubleshooting this patient is adequate history. This patient has bought glasses from you, he has trusted you, but he has problems and he wants to discuss it with you. See it in that perspective. Don't think that he is coming to trouble you, and be patient and help him to vent out his problems, and don't be defensive. Please listen to them. Now, as humans, we all need that, and that is the greatest reassurance I think we can give a patient with problem also. So we could ask questions like, what are the symptoms present, whether it was seen immediately or after some time, is it better now, or is it with distance vision, near vision, or all the positions of gaze. So all these questions can be asked to the patient, and spend some time with the patient. It is worth it. And then you could do a workup measuring visual acuity. So in this case, you have to try, if the patient has an old glass, always use the other glass and the new glass for comparison. You could very well tell them that, see, your vision is better with the new glass. Do you agree to that? Yeah. Okay. That kind of interactions should be encouraged, and check for the optical markings, whether the segment height is okay, and IPD, what we have. Sometimes there could be errors in all that, and sometimes repeat cycloplegic refraction may also be needed. And this one picture, so you have to have the optimal reading position of each eye. Not many people read at 33 centimeters. Sometimes it is more receding. So however the patient is habitually using the spectacles, always ask the patient to hold the near vision chart at that position, because that may be the favorable position for them. Actually, you can measure it. This is a very simple tape, and in needed cases you have to measure the vertex distance also, and look for the alignment and fit. If you are using a spectacle like this, it is very difficult to get the usual benefit from using the spectacles. And in case of patients with strabismus, again, marking becomes a problem, and all these facial asymmetry cases, and like sir told, 4-point touch is also important. Also diabetes, we sometimes tend to overlook that. Always ask the diabetic status of the patient before giving the spectacles. So all these Malayali old gentlemen and ladies are reading newspaper, but when you look at them, you can see that their distance is very different. So all this will have this, these are their habitual distances. You are giving a customized spectacle. You don't give a blanket distance for them. So this should be borne in mind. And if you have a patient with troubleshooting in your office, take some time and make the patient read the print or computer, and let's sort the problem in that way. And posture correction is also important. And if you have a small lesser degree of cataract, lighting is also very important in solving this. And occupation, we all know, all these carpenters, goldsmiths, and tailors, they have different viewing distances. Even with knowledge workers, IT professionals also, we do have this. We have to attend to this occupation also. So there are some special situations. See, mostly a patient with new cylinder, they will find it difficult to adjust to the cylinder. Everything is very slanted, curved. It will be a very problem for this patient. And sometimes a newly corrected hypermetrop. Me myself is a hypermetrop. So what happens, I'm very empathetic to the hypermetrops. Can I take 2 more minutes? So when you wear a new hypermetropic correction, your distance vision will be blurred, and so this has to be told to the patients. Initially your distance will be blurred, but it will adjust on its own. Take some time and explain this to the patient. And then when you get a hypermetropic glasses, please tell them use them constantly. It is not for while you reading or looking at the computer screen, because your accommodation has to be, we are manipulating on your accommodation in this correction. And high myopes with presbyopic correction, again they will have a problem. Usually they prefer to read without spectacles for some time, but again when they shift to the presbyopic glasses, they usually have problems. And some patients, bifocal users shifting to progressives, we all have had those patients. And there are now a newer kind of relatively newer kind of spectacles called no line bifocals, which is a modified kind of bifocal, but the line will not be there. And in patients who insist on separate spectacles for distance and vision, don't argue with them, just give them what they need. So they'll be usually happy with that. Giving PILs in these patients, they might buy from you, but it might be a problem for you later. And some special situations, like some people who are wearing glasses for same glasses for long periods. This may be a 612 vision, but he has been using it for past 8 years. When you give a new glass with 6.6, but they might find it difficult to adjust, because their adjustment for long periods is going to trouble us also. So the take-home messages, we can have technical problems, adaptational problems, and psychological problems in spectacles. If there is a technical problem, it's a no compromise situation, because the patient has come to you for a service and you have given a service which he couldn't use. So take responsibility. Maybe sometimes you will have to replace the glasses. And next thing which you should do is you make a investigation, CBI investigation in that sense. What went wrong? You talk with your team, because how to refine your protocols, how not to repeat it. That is very important. That is something which I have learned from my personal experience. And adaptational things, you have to give an evidence-based communication. Evidence by me, I don't mean literature. You have to talk with the patient. You have to tell the patient, see, this is your old glasses, this is your new glasses. How do you feel with this? And after spending some time, patient should tell you, yes, doctor, I feel very happy with the, I can see better with the new glasses. I agree to that. Then we can talk to them that, but you need to adjust. It will take some time. Such kind of evidence-based communication would really help. And in some buyer's remorse and all, you reassure them, but it usually settles. And don't see these patients as the pain in the neck, because once the patient has bought something from you, he feels that he has a bad experience, but he's coming back to you. That is an opportunity, because most of the patients, when they have a problem, if they go to somebody else, you will not be able to understand your problems or to solve the problem. So see it as an opportunity and overcome your own prejudice. We all feel that he's troubling me for unnecessary things, but he has a problem. That is why he's coming. Don't try to discount that problem, and listen to the patient and basically believe in the patient. Nobody will come driving a car or coming in a bus just because he want to scratch you. They have a problem. That is why he is coming. However small the problem is, try to be with the patient and be her problem solver. And we all have a good relationship between the doctors and patients. So if you are solving this problem, actually you are making that patient your trusted ally. He will come with his relatives or his family members, because see, I got a spectacle from there was a problem, it was replaced, it was corrected, and that gives you more confidence in the establishment and win back the patient. And replacement and refund policies that you have to decide for each institution. And this is a very important thing. Do not charge for the visit. Some patient, after buying their spectacle, they have come with a problem, and you are getting again 300 rupees from them. It doesn't look nice. And so this sometimes we will not be able to understand. This will be done at the reception. So make a point to refund if you have the authority to do that. And instructions on the prescription, usually we give, but ask them to read through that adaptation issues. And they say that 70% of unhappy customers whose problems are resolved are willing to shop with the same business again. So let's remember this, and thank you. So I'll be leaving for another talk in another hall. If you have some questions, I'll be happy to take. Yeah. Okay. Mm. That seems very unusual to me. So, did the patient come back after a few days after prescribing the spectacles? Did you check the blood sugars then? Mm. I think usually what I was seen is when you have a myopic shift, when the blood sugars are at least more than 300 or something. Beyond 250 and all, usually we don't have a change. And HbA1c, we are looking for the 3 months control. And what is important for us is the immediate control, which is reflected in your FBS and PPBS. So probably I think that that patient may have he might be having a high blood sugar when he came to you for the second time. And for near vision ads and all, you don't need to look for blood sugar actually. It won't affect. You think of the mechanism, what happens. So if there are no questions, thank you.
Thank you very much, Dr. Sanitha. A very difficult topic, something we all dread, but she's explained how to go about it.